Hello, everyone, and thank you for joining us this evening. The Health Advocacy Ministry each month will bring you healthy hints from HAM. This is our first session, and our topic tonight is the COVID-19 vaccine. I want to thank you all for joining us. We have a great panel here tonight. Now that the vaccine is rolling out to the general public, the question is whether you should get it or not get it. There seems to be a lot of questions and a lot of reluctance. There are a lot of sessions, such as this one, that's been held by churches and other community organizations to try and help you make an informed decision. So tonight, we have a panel of health professionals who will give us a little information about the vaccine and answer some of your questions. So joining us is Dr. Dawn Wise, Dr. Nathan Lott, Tamika Harrison, and Darlene Matthews. So what I'm going to do, since I don't have a bio, I'm going to ask each one of you to tell us a little bit about yourself and give us what your thoughts are about the vaccine. What I'm going to do is I'm going to start with Darlene because I know she has to get off the call. So Darlene, I know that you've already had the vaccine. So tell us what made you decide to get the vaccine, and did you have any side effects? Just tell us a little bit about your experience.
Good evening, Faith Ministries. I did take the shot. I got the Moderna, and I was excited to get it. I was blessed to get it, and I encourage everybody to take this shot. Because of my work and because of my lifestyle, I was wearing myself out trying not to get COVID. So I'm a hairstylist. You can't do hair from social distancing. You can't do it. I work at a funeral home doing hair, and the COVID people are there. They said I can't get COVID once they've been embalmed, but I can't listen to anybody because all this stuff is new. I got to take care of myself. I got to walk to the beat of my own drum. I'm at the shelter, and you're steady asking the people to put on a mask, put on a mask, put on a mask. So everything I do every day was having me in jeopardy of getting COVID. So I was blessed that I was able to get the shot. I had no side effects. I wasn't looking for any side effects. I felt grateful. I was blessed. And in fact, I get my second shot on Friday at 9:40. So if you take the flu shot, you got a 35% chance of getting the flu. COVID shot, a 5%. So I'd rather have that 5% than not take it at all. If a side effect, they said it could be a sore arm for 2 days, or a stiff body a lifetime. That's the funeral home. So I just encourage people to do it. We're not going to ever get back in church. Church is a mass gathering. We're not, in a minute, you're not going to be able to get on a plane without showing that card that you've been vaccinated. And I'm encouraging our community to take the shot and quit making excuses on this shot, because we're all going to need it in order to move around eventually.
Thank you, Darlene. So you're excused.
Thank you. Bye. Take your shot.
Okay, let's start with Dr. Dawn Wise. Dr. Wise, can you tell us a little about yourself and what are your thoughts about the vaccine?
Hi, glad to be here with all you guys. Darlene, great information about the shot. I'm so glad you got it. I can't wait till I get mine. My name is Dawn Wise, and currently I work in the College of Public Health at The Ohio State University. We're very busy right now. I work with graduate students. My background is in molecular genetics and public health. So I have a PhD in genetics and I have an MPH, a Master's of Public Health. And as a result of that, I got a Master's in Public Health to try to help educate the community about health topics, about diseases, about things that plague underrepresented minorities, things like diabetes and heart disease and different genetic disorders that we inherit. And so when the pandemic came along, several people that knew that I had that background asked me, so do you think they're going to get a vaccine made? And at first, a year ago, I was like, it takes too long for vaccines to be developed. I don't know about it. But after I looked at the research and followed CDC and followed Pfizer and Moderna and looked at the original research papers and listened to the FDA panel the day that they approved the Pfizer and the Moderna vaccine, what I realized was that the research that has taken place over the last 15 to 20 years in molecular biology. That means biochemistry and the chemistry of basic cells has advanced so far that researchers have been trying to make a vaccine like the Pfizer vaccine and the Moderna vaccine, that's an mRNA vaccine, for a long time. So when this virus was released in humans, they had all of the pieces of research already set in place, so they could just make a vaccine pretty quick to the virus. And because so many people around the world were working together in labs all over the world, and our government and all governments put so much money into it, then I was really pleased with the outcome. And like Darlene, I know now that I know Darlene has had the shot, I know at least 8 people that have had their first shot, and none of them have had any side effects. I understand that we as African Americans are very hesitant about taking the virus because of our history as oppressed people in this country, our history of having been experimented on, the Tuskegee experiments, all of these different things. But at this point, I am very happy with the outcome, and hopefully, all of us will be able to get a vaccine. And as Darlene said, return to normal life. We need to wear those masks. We need to social distance. It's for real. And if we don't, what's going to happen if enough people do not get the vaccine? 75 to 80% of the United States population has to be inoculated with the vaccine in order for enough people to have the vaccine to protect those people that are vulnerable that can't get it. Okay. So until they get to that 80% mark, they're going to still tell you wear your mask. They're going to still tell you social distance. They're not going to allow us to go back to an OSU football game in masks and things. So I know we're kind of skittish, but I believe that God allowed that vaccine to be made quickly because He wants us to have faith in Him and wants us um, to step out. You know, we take risks all the time. And like Darlene said, only 5% of people will get it. And even if you get it after you have the vaccine, the data says it will not kill you.
Thank you, Don. Dr. Nathan Lott, can you tell us a little about yourself and your thoughts about the vaccine?
My name is Nathan Lott. I am a physician. I practice in pulmonary and critical care medicine. I currently live in Texas, Waco. I practice in the intensive care unit, as well as seeing general pulmonary patients, so people that have lung diseases like asthma, COPD, and other such diseases. My road to vaccination, I've received both. I've received my second shot yesterday, actually, and I'm still alive. I still have 2 legs, have not grown a third eye, uh, and still alive. So it's good. The road to getting the vaccine for me was similar to the previous panelist. I, a year ago, would have said, you're not likely to get any vaccine within the next 2 to 3 years, just based off of the standards of vaccine production, going by the traditional mechanisms and methods that are used to generate vaccines, testing, and things like that. When whisperings first came out about the Moderna and the Pfizer vaccines, I was like, we'll see. We'll see what happens. Uh, not certain what the long term, not certain what the effect the vaccine is going to have on people's contracting the virus. But as the data came out, as the research was done, and just kind of reviewing the stuff, I became less concerned about the possible side effects, particularly in my field. I see the worst of the worst. I see the people that get sick, end up on the ventilator, and die. It's not an easy thing to do, particularly professionally, because there's so much that you wish you could do, and some of it just can't be done, or the body just doesn't respond. So for me, it was a no-brainer. Getting this vaccine was certainly something that I felt was necessary as a way to help improve our ability to combat this virus in a way that will allow more people to survive and allow more people to live and have a productive life afterwards. There are people that have talked about, oh, I'm gonna just get the virus. I'll get the infection and then I'll be fine. Oh, the data shows that there's a 30% of people with it have prolonged side effects, severe debilitating shortness of breath that is not something that's easily treated. And this is in healthy people that don't have any comorbidities. So for me, it was kind of a no-brainer. Yeah, there's a percentage of people that will get the infection and may have a very mild course, not have any lingering side effects, but that flies in the face of those who won't have a good outcome. So for me, it was just a no-brainer. There was no reason not to get it after having had the time to peruse the data, and the current literature supports that the vaccine will prevent severe disease that should require intensive care unit admission and care. So I'm all for it.
Tamika Harrison. Tamika is our registered nurse on the panel, and she's going to also be asking you guys some questions. So, Tamika, you want to tell us your thoughts about the vaccine?
Sure. Hi, my name is Tamika Harrison. I am a registered nurse. Today, I work at the Ohio State Wexner Medical Center. I actually, as a nurse, am a case manager. So, just want to share a couple things. I actually had the virus. I was actually infected probably at the beginning of May. Um, my symptoms, fortunately, I was very blessed. I thought I had a cold. I literally thought I had a cold because my symptoms mirrored exactly what my colds look like. It wasn't until my husband said, I don't feel well. I have a fever. And I thought, that's strange because he hadn't been anywhere. So we went to get tested. Lo and behold, we were both positive. But again, our side effects were very minimal. So we were blessed in that aspect. I too, because I do work in the hospital with people every day, I got vaccinated. I've had my first vaccine a couple weeks ago. The only side effects that I experienced was I did have a sore arm for maybe 2 days, but after that, absolutely nothing. And I am up for my second vaccine on February 8th. I will have to say I'm looking forward to it. The reason being is because when I go to work every day, unfortunately, we see people die every day. And until, like many people have said, until the majority of us get vaccinated, we won't be back to that life that we know of as what we would call normal. From even a case management perspective, it breaks my heart now that we're in this pandemic. You can't, your loved ones end up in the hospital with the vaccine. You can't come and see them. It's unfortunate to see people die alone. It really is. And so I encourage everyone to get it. convinced my family, because they had some hesitancy as well. And I said, well, use me as the example. Let's see how I do with it. I've now convinced my husband to get it when his turn comes, and my children as well. So I do encourage everyone, if you could, take advantage of the opportunity when it comes your way and get the vaccine. Because in the long run, the hope, the thought behind it all is that we will get back to some normal life, not having to always wear masks, not always having to social distance, be able to return back to church and hug someone. So again, I encourage each of you, if it's in you to do it, do it. The side effects aren't as grave as people say. I'm proof. And
So
so,
thank you, Tamika. And so we have questions.
yep. So our first question, and I think Dawn and the doctor, you answered a couple of them in your intro, but we'll go for it again and see if we get anything different. So we only get one shot for the flu and one for pneumonia. Why do we need two for this virus?
Whoever wants to answer.
So the vaccine uh, is a targeted one that introduces the message to the cell to produce the spike protein that the body reacts to, which is what induces the antibody response. The purpose of having the two shots is the virus is not very immunogenic at baseline, meaning that it doesn't by itself generate a strong immune response, which is why people are able to get a second infection after they've had the virus the first time. Um, in general, a infection that your body reacts to, you develop antibodies, and those antibodies will fight the infection, and then you can develop a long-term memory cell that remembers the infection and allows you to generate a quicker response after reinfection. In this case, the virus does not cause that strong of a reaction. So the second shot is to provide a booster. So not only are you getting that first shot, you're getting a second exposure, which is supposed to help enhance the immune response and help you to develop a stronger uh, memory response to it. It's not been long enough to know for certain what's the long term length of that immune response, but I'm sure there are certain studies undergoing that as we speak.
Thank you.
Exactly.
The next question. I'm sorry. The next question that was
Go
brought to
ahead.
us: what are your thoughts why people of color are so reluctant to get the vaccination? And I know, Dawn, you had alluded to it a little bit earlier. Maybe you can expand on it, or if you have any additional.
Well, I think in general, people of color, and what research shows is that people of color have always had a kind of antagonistic relationship with the health system here in the United States. As I said, when we were slaves, we were experimented on, we were treated badly, we were given things that they know would hurt us. The Tuskegee experiment, where they knew all of these black men in Alabama had syphilis, but they would not treat, and they used them as guinea pigs. Those collective memory, and that has made us hesitant. Research has also shown, and we know from our personal experiences, that when we go to the doctor, we don't get the same treatment the majority culture gets. For example, Serena Williams died in childbirth. Right? She had telling the doctor something is wrong, something is wrong. They couldn't listen to her. They said, oh, you're fine. You just maybe you're sore. You're this. Had blood clots on her lungs. She knew things were wrong, but they wouldn't listen to her. So we don't get the think the pain. Of these experiences make us hesitant. And then the other thing, reason we don't want to get shots is because we pay too much attention to social media and bad press. And we listen. Oh, somebody said if you take the virus, the vaccine are giving you a microchip. No, that's not the case. So, because of all of those things together, I feel very hesitant to get the vaccine. And with this whole thing, we don't know what's going to happen. And with the whole political environment, we're kind of like, they might be trying to kill us, or we're already dying. So, why are we going to take the vaccine? That's why we should take it, because we're at higher risk.
Okay. Thank you. So should people with autoimmune disease, should they be vaccinated as well?
Dr. Lott? So we're not hearing Dr.
I didn't, but it looks like I don't see his lips move. Okay. Um,
Can you hear me now?
yes. Sorry.
Okay. The long and short answer to that question is, barring some uh, barring some reaction, i.e., you have a documented reaction to the vaccine, you should be vaccinated. So autoimmune, pregnancy, the only people that truly are exempted from it right now are kids under the age of 18 for the Moderna vaccine, and I think under 16 for the Pfizer vaccine. And that's because those particular groups were not studied when they did the trials for the vaccinations.
Okay. Thank you. So it usually takes years to come up with a vaccine. How safe is this vaccine since it was founded in such a short period of time?
Safety is generated under your phase 1, phase 2 trials. Phase 3 helps you to determine what the larger population-based studies, and then phase 4 is where they look at the longer-term effects of the vaccinations or drugs when they're doing development. So that being said, yes, timing-wise, we are fairly early in the lifespan of this particular vaccine, and is there a lot of long-term data? Not just yet. Again, it is fairly new, but the information that is out thus far does not demonstrate any significant complications from the vaccination.
I just want to interject that I think did we lose Dawn? I'm not sure.
That
I believe she's in and out. I think she's driving. Her signal may be.
Yeah, she's on her way to New York.
I'm kind of in and out. No, I'm actually here. Can you hear me?
Yes.
I'm sitting in the parking lot. But what I was going to say was I agree with everything the doctor said, and he said it so eloquently. But the other thing you have to remember about why I like this vaccine is made. You know, when you look at the pictures of coronavirus, and the spikes sticking out of it, the vaccine is made to spike. So they take a little strip of what we from that strip, and then they
So Dawn, we
introduce
really have
it into the vaccine.
What she was saying is that the vaccine is designed where, taking it way back to, and I'm going to make it simple. Um, I'm sure a lot of people are aware of uh, automakers and how you have your production lines where you're producing, car parts, headrest, all that stuff. All of that stuff that's produced, there's basically a instruction manual that says this is what you do, this is how you make it, bam, all that's programmed into the computer. It does all that stuff, and they can automate a lot of it. The body has similar mechanisms. The way that the genetic code, which is stored in your DNA, is utilized for your cells to do their specialized functions. The ones in your lungs that help with breathing, the ones that help with getting oxygen, the ones that help make hemoglobin, the ones that help. All of that information is stored in your DNA. Now, your body doesn't take the DNA out of the nucleus, send it into the cytoplasm, and do all that work because uncoupling it and doing all that could be problematic, especially if there are issues getting it back. What happens is it takes a read of the code and creates what we call messenger RNA. That RNA is exported from the nucleus out into the cytoplasm, which then goes to the organelles that produce whatever that instruction manual tells it to produce. So what this vaccine does is it provides a lipid sphere where that messenger RNA is protected. And when you get the injection, that lipid sphere gets carried into a cell, merges, and then distributes that messenger RNA into the cytoplasm. Goes to the machinery and says, hey, produce this. When it produces that, those spike proteins go to the cell. When it goes to the top of the cell, that's what causes the reaction to tell your body, hey, this is abnormal. It recognizes the spike protein as abnormal, and that's what induces the immune response. And when the cell eventually dies, it chops up some more of that protein and produces it on a special type of messenger that stimulates your T cells, which are your cells responsible for that specific immune response to infection. And that stimulates them to say, hey, and remember, hey, this is really, really abnormal. And then when that does that, that's what prompts you to have that immune response upon reinfection.
Thank you. What are some of the side effects of getting the vaccine?
Biggest side effects are going to be injection site reaction. Some people have just a lot of pain where the injection occurs. Mine hurt. When I get the flu shot, it usually hurts for about 12 hours, and then I'm good for the rest of the day. This one, was a little tender for about a full 24 hours, and then it kind of went away. I've seen reports of patients having high fevers after they've gotten the virus. So it hit like 102s, 103s, 104s. And some of them thought they may have had the infection or that they may have caught coronavirus. But I believe it's just the reaction to the vaccine. And they did fine, at least as far as what I've read. One of them was a nurse involved in the initial trials for the vaccination. So, and she wrote a little op-ed about it. I can't remember which where that op-ed was written, but I do remember reading it. And take some Tylenol, or Motrin, and help to kind of get the fever under control, and that should be fine. But those are the most common reactions that I've read. Now, I'm sure that there are more. People respond to different medications differently. So some people may have, headaches. Some people may complain of rhinorrhea or like a runny nose. But the most common one is an injection site reaction, and some people develop fevers.
And then I can say I know someone personally who, after her second vaccine, oh goodness, she ended up with the headache, and she had the nausea and vomiting, which was that was the first time I had heard that from anyone. And the body the body aches, so kind of put her out for a day, but she's bounced back. So I think it's
good.
Those effects, the same side effects that you get from any other vaccine, actually, that they warn you of, before you get the vaccine. Okay. Let's see. What's in the vaccine? Does it contain any type of live virus?
No, it is a messenger RNA vaccine, which means that it contains the way that it's described, it has biolipid sphere, and that sphere contains the messenger RNA molecule, a messenger RNA template to tell your body to produce the spike protein. And that's it, just the spike protein. It doesn't have live virus. It doesn't have parts of dead babies in it or any of that stuff that so you've probably heard it some in random places. But it's literally that and the messenger RNA. And there may be some other little things in there to help maintain the stability of the vaccine, but in general, that it's the mRNA and the molecule that helps to keep it so that it gets absorbed by the cells.
Okay. And I have an Adlib question. Many times they say if you're allergic to certain things, you need to let them know what your allergies are before you get the vaccine. What major allergy are they concerned about when asking that question?
I'm not certain. I know for flu vaccine, a lot of it is, egg allergies, and that's because your flu vaccine is basically matured in egg yolks. And that's why that egg allergy is listed. Now, there are, say, recently over the last 3 to 5 years, they've come up with a vector that doesn't use egg yolk for it to mature. So they do have some that people that have egg allergies can get their flu vaccine now because it's not all of it's matured in egg yolks. But that's it for the flu vaccine. I really have no idea about the ones for the mRNA vaccine.
Okay, thank you. Folks want to know how effective is the vaccine, and that could be Pfizer or Moderna.
95%.
Is that for both of them?
It's 95% for the Pfizer vaccine. I believe the Moderna vaccine is 93 to 94%, but you're quibbling over bit. And it's the effectiveness at helping to prevent severe disease requiring an intensive care unit stay and or intubation, I believe, was the endpoints for those studies.
Okay, at this point, we're going to take some of the online questions. We have a lot of questions online. So, Mike, do you want to give us the online questions?
You did and ask them what the number is. Call them down.
Tamika,
So
you want to read that?
If the vaccine that needs to be stored at a certain temperature and it wasn't, but injected into people, what problem may the person encounter?
They're not supposed.
Go ahead.
Go ahead. No, I was going to say they're not supposed to use the vaccine. I know I look crazy, but I don't care. If it has been left at a certain temperature. But the reason it is like that is because RNA denatures at certain temperatures. That means the molecule falls apart and the components that it's made in, the lipids that the doctor was talking about, don't work anymore. And so they should not ever inject you with vaccine that has gone above the recommended temperature. That said, we don't know what would happen if they did, but I am much less concerned about the response that you would get from this type of vaccine than from vaccines that are made from the actual virus itself. This vaccine, like the doctor said, comes from a specific component, a small molecule that comes from that spike protein. So yes, it would elicit some type of immune response, but it would not be dangerous as if they injected you with what we call attenuated virus. That means they isolated virus from somebody, heated it up, which killed the virus. And that's what they used to use for like polio vaccines, mump vaccines, measles vaccines. You were actually getting the virus that caused the disease that you're trying to prevent. In this case, you're getting a small molecule. So even that reaction in your body should theoretically be less.
That is
Thank
correct.
you.
That is correct. More than likely, the side effect is just an ineffective immune response to the virus. So you won't necessarily get the therapeutic treatment or the therapeutic vaccination if you're injected with it and it wasn't stored appropriately.
Thank you.
Thank you both. Um, Mitsuva asks, how long is the vaccine good for? Will we have to get it every year or 10 years like a tetanus shot? They don't talk
Mm,
about that and why.
I'll say shortly, they don't talk about it because we don't know. All of us are part of a larger study where they will be determining that. And so that's part of what's up in the air.
Yep, I think many of the individuals that were involved in the earlier, like phase one, phase two, maybe even phase three studies for this virus, I'm fairly certain are being followed very closely and tested to see are they producing antibodies? What's the concentration of those antibodies in their body? And using that as a way to get an idea of the length of the immunity granted by it. Moderna released something recently where they said they are confident that the immunity granted by their vaccine is going to last at least a year, and that's something that they recently put out.
Oh, nice. Thank you.
Okay.
Next question. If you are a transplant recipient, is it safe to take the COVID-19 vaccination?
I'm gonna
Good.
I am going to refer to my previous response in that unless you have a defined reason not to get the vaccination, you should get it. That being said, transplant recipients are on immunosuppressants. And
Mm,
while the mRNA vaccine does not contain live virus, sometimes immunosuppressants can impact, as they're supposed to, the body's immune response. So it's better if you're a transplant recipient to make sure you follow up with your transplant physician and ask them directly what their recommendation is regarding the use of the vaccine. But I'm fairly certain they'll say yes. And if they're unable to get it, as was referenced early, they're one of that protected population of people who would be unable to get it. And because they're not able to get it, vaccinating everyone around them helps to improve their odds of not getting infected. The analogy that I like to give when talking about immunity is forest fires. When you have a forest fire, one of the things that they train to do is called a fire break, which means you have a pocket where the fire is and you burn every area around it so that the fire is contained in one spot and can't travel outside. It's not effective if you just burn one area, then it'll just spread to the spot that you didn't get. So one way to help to contain it is to vaccinate everyone around those people that might not be able to be vaccinated to help protect them from those that may have it or the reservoir and can pass it on to others.
Okay. Thank you.
And I like to think of the herd immunity that the doctor just described um, as we're people of faith, and God God tells us to take care of one another, love one another. And so when you're getting the shot, you're getting it for that person who might be immunocompromised and can't take it. So if all of us around those people get the shot, we're helping protect them and everyone else that's vulnerable that cannot take it. So just the act of getting a vaccine is you taking care of yourself but you're also taking care of your larger community. And so that's an act of selflessness.
Thanks for that, Dawn.
Absolutely. Thank you. What vaccine should we take? What's the difference between Pfizer and Moderna?
Honestly, do you like driving a
Here, come
GMC Acadia or do you like driving a Ford Bronco?
Good.
My point being, it's up to you. The difference is the Pfizer vaccine is stored at a much colder temperature, and the Moderna one is not. The Pfizer vaccine has a 95% effectiveness. The Moderna is 93 to 94. Quibbling over bits here because they're both considerably more effective than some of the others that are out there and in use in other countries. I, I was looking at this the other day. I forget the country, but one of them has a vaccine that is 60% effective, which is really low considering
Mm-hmm.
the severity of this disease. So, uh, which one you take is literally going to be up to the facility that you get your health care from or the public health entity that will be providing the vaccine for you. And the recommendations are to stay with one vaccine, although recently they were stating that you could, if no other vaccine was available, you could go from Pfizer to Moderna or Moderna to Pfizer. But that, I think, is still kind of early in the CDC's recommendations. If you just can't, if they can't give you the second of the one that you already have.
Thank you. And I just have I wanted to piggyback onto that question. You can't pick and choose which one you get. Is that correct? It, like you said, it depends on your healthcare provider, where you're getting your vaccination at, depends on what they have on hand at that time. Is that correct in saying?
As far as I understand,
Okay. Okay. Thank you. Any other questions? Okay. Um, I have urticaria, chronic hives, and am allergic to sulfa drugs. Is the vaccine safe for me?
I Everything I've seen, I concur with what the doctor said. But what I also tell people is ask your physician. Your physician knows your medical history. They know if you break out, say for instance, the people who have had allergic responses to the Pfizer or Moderna vaccine so far have been people that often experience anaphylactic shock, which means they're allergic to things like it might be shellfish, it might be nuts, it might be certain types of fibers in the environment. So that means when you have an allergic response, you're having an immune response. And I think a lot of times we don't realize that allergies are our immune system responding to the environment we put them in. And so I would consult with your physician, but once again, even with those pre-existing conditions, the vaccines seem to be okay.
to add on to that, um, for those who have history of allergies, they recommend getting the vaccine or seeing an allergist and then getting the vaccine. So, as you're saying, you definitely need to consult your doctor, and if they have any reservations about you receiving it, they may refer you on to someone to also take a look at you and see if there are any modifications that can be made to help it so that you are a good candidate for the vaccine.
Thank you both. Any other questions? Okay. Karen asks, the nurse said she had COVID and received the vaccine. Can she get COVID again?
So if she's gotten both vaccines, or both shots, I should say,
I've only
to
had
pro.
one. I've had the first
If
one.
she's only had one, uh, I don't know. I don't know for certain. I have heard of people who have gotten the first vaccine and then got COVID, afterwards. Now, the immune response from a vaccine is not immediate. The immune response from the vaccine takes about 3 to 4 weeks to kick in and induce the immune response that we're looking for, which is why the second shot for these is between 21 to 28 days afterwards. So even though you're getting the shot, remember, you're still at risk until you've had your second shot. And that second shot is really to help kind of boost the immune system and try to get a better response. So you could still catch it in that intervening time between your first shot and the second shot.
Thank you. Okay. Good questions. Anything else out there? Um, Diana Bassett asks, has there been fatalities after receiving the
Yeah, when
vaccine?
So I have seen in California, I believe, there have been some documented fatalities after vaccination. What I have not seen is whether it was due to the vaccine or due to the application of the vaccine in populations that may uh, have already been near terminal as well. So
Mm,
I haven't seen anything specific about whether the vaccine has been the cause of mortality, or if there are vaccine related deaths or just vaccine associated deaths.
Yeah, that's
thank
what
you.
I've also seen too.
Okay. Why haven't vaccines for cancer and other diseases been developed as quickly as COVID? People have been dying for years from other fatal diseases.
The diseases didn't cause a pandemic. You know, it's all in America, everything's hooked onto money. So money, numbers, who gets it, who doesn't. And as far as cancer is concerned, only certain cancers are caused by vaccines. So vaccines wouldn't help. But cancers, when we say the word cancer, we're talking about so many different forms of cancer that all start with mutations in DNA. So I don't think we will ever have one treatment for cancer. I worked in a lab as undergrad that did research that crossed over into causes of cancer. But each individual type will have different things, different ways that they're treated. And now that we understand so much about DNA, they will start catering treatments to you based on the genes that you have. And so I think a whole lot more research will go into cancer, things like HIV. A lot of the research, previous research done on HIV by people like Dr. Tony Fauci, who we all now know, um, is the research that was used to make these vaccines so fast. But they've never gotten a vaccine for HIV because the virus itself mutates so fast and so quick that it's been hard to target an area of the vaccine of the virus that they could use. So there's so many things that go into why we find cures. A lot of times cures are found when you're looking for something else. So science is so complex that if you don't have the money, the time, and a concerted effort by a lot of people, it takes a long time to do research and then to test the findings so that we don't hurt ourselves when we're trying to treat ourselves. So unfortunately, it always comes back to money and the number of people that are affected.
I did want to clarify a previous answer. So there was that question about COVID infection after vaccination. And what I wanted to say is it is entirely likely you could still become infected after the vaccine, but the key, what was the study looking at? The study was looking at what's the likelihood that you're going to get sick and die from the infection. And that's what we're treating for. The likelihood of severe disease after infection is much lower uh, after the vaccine than it is before. So you're vaccinating not to necessarily prevent you from getting the infection, but the vaccine is to help you survive that infection. Does that make sense?
Yes.
Yes.
Definitely.
Okay, any more questions? Is that it for, oh, okay.
Okay. I I took my mom to get her first vaccine. Less than 1%. No, less than 1% of people at the shop were Black. I understand why we are reluctant to get the vaccine, but what happens when things I can't. I'm
Open.
sorry. When things open again.
Open.
Thank you. Also, um, also am a home health aide with 2 high-risk patients. Where can I get my vaccine? That's a good question. I
It's a
can tell
very
you there's lots of you can always check with your primary care provider to see if they're providing it. There is a you can go to the website columbus.gov, and they have a listing of all the places that are providing the vaccine. But I will tell you this, just on from personal experience, on Sunday, I went to that site. I was able to get my dad. I went to that site. It was probably 2 p.m. on Sunday. I got my dad signed up to receive his vaccine for Monday. My dad called me and said, "Hey, my friends can't get on. Can you take a look at it?" I went back to the same site on Monday, 24 hours later, and it actually says right now they're no longer scheduling. Um, and that could be based on the availability, is what I'm thinking. And so we just have to continue to check those sites to see when they're going to open up again. Um, some of the pharmacies within the different grocery store chains, they do provide it. But again, based on availability, it's checking the sites to see if and or when you can sneak in an appointment. Many, as of even earlier today, didn't have any availability. So I think it's one of those things where we have to wait until they can distribute more to get to those different facilities.
Okay, do we have any other questions? Every time I ask
Will
that, here
sickle
comes a
cell
question.
These are great questions, though. Will sickle
refer
cell
to my
Yeah.
previous
patients will sickle cell patients be able to take the vaccine, and how will the vaccine affect sickle cell patients?
refer to my previous response, and the last half of the question. I don't believe anyone knows. Again,
Okay.
it's early, and as the numbers of people that are vaccinated, um, more information, more data will come out that will be published and can be used to help refine these questions and refine the answers to the questions too.
I have sickle cell in my family. I don't have it myself. My uncle has it and my cousin has it. My uncle had COVID and almost died. So he's up to get the vaccine in the next week, and he's very excited about getting it because um, it was kind of crazy, but his doctor definitely wants him to get it. So that's all I can tell you. We don't know, but he's excited about getting it. And he had COVID about 2 weeks ago, and he was down for about 3.5 weeks.
Wow.
I have a
Miss
patient
Ella,
that is 4 months out from their COVID infection, and they're still having a lot of symptoms because of it. So again,
different
for
everybody.
me, it's not really a question. It needs to get done, particularly if
Mm.
we're talking about trying to protect our health, our livelihood, and wanting to survive and be able to do the things that we like doing. It just needs to be done.
Amen.
Okay, we've had some great questions this evening. Uh, I think there's one more.
Take the last one. Okay. After receiving either the first or both vaccines, is there any information on continually being tested?
I have no idea.
I was gonna say I haven't heard.
I saw that because we're not at herd immunity yet, that for different activities like flying, they're still going to want you to get tested. Um, just just because. Now, I don't know. I think everybody's going to have to play that by ear with their specific lifestyle and what's going on. But once again, we need to get to that 75 to 80%. And as the doctor says, unless they tap you on the shoulder when you fill out the information and register for the shot and say, you can't take it, please get it. Please get it.
Mhm. Mhm. Mhm.
I have one question myself because my number is coming up where I can actually go and get the vaccination. And Don, you know I'm not good at that, right? Anyway, I had a light bulb moment the other day. You know, I'm from that era where we took smallpox shots, we took shots for uh, polio, we took shots for measles, and all kinds of
Mumps.
things. What makes this vaccine any different than those? We're still alive.
Exactly.
Um, yeah, um, most people in this age group have never had to deal with the complications of smallpox, the long-term complications of smallpox. Uh, Back when smallpox really flared up, one of the things that I believe led to the uh, mass compliance with vaccination was seeing the fields of iron lungs, where
Mhm.
the virus would attack the respiratory muscles and the nerves, and kids couldn't breathe. So if you can't breathe, you die. So what they created were these iron lungs. Basically, you put the kid in this thing, and it would alter the pressure so that they could breathe until they were able to start breathing again. And just imagine seeing fields as big as a shot where all you see are kids in these machines, because they can't breathe without. And it's that image, I believe, is what really got people in that day and age to, settle down and say, you know what, you're going to get this thing, and you may have to deal with whatever the reaction is, but the other long term complications of that smallpox vaccinate or smallpox itself is a long term debilitation where their limbs can shrink, they atrophy, they lose the ability to walk, and some of them end up on ventilators where we have to put an airway in their trachea, and they're on a ventilator for the rest of their life. So some of these long term complications from smallpox were eliminated by vaccinating again. So yeah, again, it comes back to the what are we? We're trying to achieve uh, a treatment that's going to help to prevent long-term morbidity, long-term mortality in the largest number of patients, the largest number of people, and this vaccination is at this time the best way to do that.
I guess my point I was trying to make is that we took all those vaccinations without all the questions that we're having right now about why we should take this COVID vaccine. I think that's the
Mhm.
point I was going to try to make, that we took the polio shots and we took the smallpox and we did the tuberculosis and all that stuff back then without all these concerns that we have about this COVID-19 vaccination. I think that's the point I was trying to make. And we're all still walking around here, without three eyeballs or whatever. So
Exactly.
after having that light bulb moment the other day, like I say, my number's coming up. That's what me decide, you know what? I'm going to get the vaccine. I'm going to take it, and for myself, for my family, and for all those around me.
And we
Amen.
would
So
love
I
we've
to get
had a
agree.
great
signed up for it.
discussion tonight. I'm so excited because I was getting really nervous earlier. You just didn't see me sweating. But we've had a great discussion. I've truly enjoyed. I thank you all for taking time out of your evening. Doctor, thank you. Both my doctors, thank you so much. Tamika, thank you. Mike, it was a great evening. And thank the audience for joining us. Have a great evening.
Absolutely.
Thank you.
Thank you,
Thanks.
Thank
guys.
you, everybody.
Be blessed.
Thank you.
Be safe with the vaccine.
My closing remarks.